Hello, psych students. Welcome back to another psych flip video. So this one we are going to cover today is module 17, and I'm going to talk to you about what happens if you don't get enough sleep, different kinds of sleep disorders that we have, and also some theories around dreaming and why exactly we have the dreams that we have. So first of all, starting with sleep loss, there is a study from a 2013 Gallup poll that says 40% of Americans reported getting 6 hours or less of sleep a night. So obviously, a lot of times the general recommendation is about 8 hours. It actually really depends on your age. If the younger you are, the more sleep you need. As you tend to get older as an adult, that amount that you need starts to go down a little bit. However, just in general, we're seeing about a lot of people having about 6 hours of sleep or less a night. So, what are some of the consequences of sleep loss? It's actually super, super dangerous and unhealthy. So, one thing is that for students, we can see less sleep means you have more conflicts in friendships and romantic relationships. It also can result in worse grades as well if you're not as fresh and ready to go each day with your schoolwork. Sleep loss is a predictor of depression as well. So, obviously, that is a side that mentally can be very dangerous. And sleep deprivation increases your appetite in eating. Our brain finds, if it's tired, tends to find fatty foods more enticing. So that can obviously lead you down a road potentially towards obesity or something along those lines. But that's not all, there's more. So, sleep deprivation can also suppress your immune system cells. So, that means you are more susceptible to different kinds of illnesses like viral infections and also cancer. Those with less than 5 hours of sleep a night were 4.5 times more likely to develop a cold than those who slept more than 7 hours a night. And also, older adults who have no difficulty falling or staying asleep tend to live longer than sleep deprived age mates. So, you can see there are tons of reasons why it is really important for your physical and your mental health and just your general longevity of life. It's really important to make sure that you are getting a lot of sleep and a proper and um, amount of time sleeping. So please make sure that you are keeping up with your sleep. I will also throw out another statistic as well that is especially relevant to all of you as you are starting to drive, or maybe you have been for a couple years. And that is also that if you get 4 hours or fewer of sleep a night, that tends to lead to the same motor functioning as if you are over our legal alcohol limit. So, at least in the state of Maryland, the legal alcohol limit is 0.08 for your blood alcohol content. But having 4 hours of sleep or less a night can make you at somewhere around zero point 0.1. So, obviously, it is very, very dangerous. That means like your brain is not able to operate at full capacity. So sleep is so, so, so important. And I feel like I try to stress this a lot, but I really mean it. And I hope that you realize that. I believe during class we'll have some time to do the sleep deprivations survey, but if we do not, feel free to fill this out on your own. And it gives you some information to help you figure out if maybe you might be a little sleep deprived or not. Something that is very common in today's world as well is that smartphones can get in the way of sleep. So, whether it be that it literally disturbs you in the middle of the night, you receive a text or some other kind of notification, a phone call, that can definitely wake you up and then keep you on your phone. It can also make it harder for you to fall asleep. So, one of the things is that the blue light can definitely be a little bit harsh on your eyes and actually kind of mess with your brain chemistry and make it harder for you to fall asleep. Um, Sometimes screens can also just get your brain active and stimulated and everything. So if you're laying in bed and staring at your phone, that's telling your brain that it's still time to make sure it's sharp and it's looking at all these things rather than that you're in the mode to try to start winding down and falling asleep. So, highly recommended that you actually don't necessarily keep your phone right next to you while you sleep, or that you have some other kind of nightly routine where the last thing you do before you go to bed is not looking at your phone. So this image here, you can look through a little more on your own, but is kind of telling you exactly all the stuff I was just sharing of how dangerous physically and psychologically it can be for you to not get enough sleep. So things like more fat cells are being produced, you have reduced muscular strength, you can have more joint pain, all of those kinds of things, and your brain definitely suffers as well. You're absolutely not as cognitively sharp if you are sleep deprived. So something else related to driving, again, is that when we have changes in daylight savings, we also see that that tends to tie to more accidents in vehicles. So when we tend to have the springtime time change, when we lose an hour of sleep, we tend to see the number of accidents drastically increase during that amount of time. And then the day, whereas in the fall, like we're about to have, where we gain an hour of sleep, we tend to see fewer accidents actually. So you can see how amount of sleep can actually really help determine your driving abilities. So take a look at this question here. Sleep deprivation can lead to weight gain, reduced muscle strength, suppression of cells that fight common colds, and also most likely which of the following here. So take a second to check that out and think about the answer. So this correct answer would be letter B. It can also lead to depression. So it is extremely important to make sure that you are getting enough sleep. So please, please make sure that you are. Very, very important. So now we're going to talk about some different kinds of sleeping disorders that we have. And this chart does a great job here of summarizing all the different sleep disorders. It's in your textbook as well. So I highly recommend looking through it to kind of as a way for you to have a summary of it all. But we are going to talk through each of these right now. So one kind of sleep disorder is called insomnia. This is probably one of the most common ones that you may have heard of. And it is also frequently common too. About 1 in 10 adults or 1 in 4 older adults complain of insomnia. And that is basically when you have problems either falling or staying asleep. And of course, everyone has that happen sometimes where for whatever reason, you're just kind of pumped up that night and you can't fall asleep. But insomnia is more that it's a persistent problem you're having over and over. That can definitely lead to chronic tiredness and obviously, again, increased risk of depression. So it's extremely important to make sure that we are getting enough sleep. And if you do feel like you have insomnia, that you actually go get checked out with that because we might actually be able to treat it with medication. And insomnia does tend to become worse when we worry about it. So that's one of those times that your mind likes to play tricks on you. The more and more you think about, oh, I just need to fall asleep, I need to fall asleep, the harder it actually makes it for you to fall asleep. So one thing that is really important to note of how not to treat insomnia is using things like sleeping pills and alcohol. Sometimes you might think that those things actually help you to fall asleep quicker, which might be true, but then that can definitely leave you feeling um, more aggravated the next day and not actually super well rested. And if you continually use those kinds of things, that can lead to tolerance, which we'll actually talk about in the next module, but that means that you need more of that thing to produce the same result. So definitely recommended that instead you see a doctor and get specific medication that can help with insomnia rather than just using your own sleeping pills, and definitely not alcohol. Another type of sleeping disorder we have is called narcolepsy. And that is about 1 in 2,000 people that tend to have that. And that's when all of a sudden you are completely overwhelmed with sleepiness and you actually like fall asleep right then and there. So of course, again, we all have times where we're really sleepy, we keep falling like nodding off, those kinds of things. But narcolepsy is an actual condition where you might be in the middle of doing something and then all of a sudden you just fall asleep. So this can be very dangerous potentially. As it says here, it can often occur after you're triggered by some kind of strong emotion. So it can be really dangerous too if you are in the middle of driving perhaps, and then you have an attack of narcolepsy, you could literally fall asleep right in the middle of driving. And again, it's not the same thing as not getting enough sleep and just being sleep deprived and falling asleep, but instead an actual condition that makes you fall asleep for usually something that lasts less than 5 minutes. So there are some videos we'll also check out about that kind of talk about narcolepsy a little more. Next type of sleeping disorder is called sleep apnea, which occurs in about 1 in 20 people. And that means that throughout the course of your night, you intermittently stop breathing a little bit. So after about a minute without air, your decreased blood oxygen tends to then arouse your system and make you snort in air all of a sudden, kind of like waking you up to make sure that you do in fact get the air that you need. So eventually you will get the air, but of course that leads to a very disruptive night's sleep, constantly waking you up if you're like gasping for air all of a sudden. A lot of times people with sleep apnea don't actually recall these episodes the next day. So it might be that someone else notices it, but there is a treatment potentially for sleep apnea, and this is called a CPAP machine. Unfortunately, not the most attractive and inconspicuous treatment we have here, but it does tend to help people. So basically, it's a machine that kind of applies mild air pressure to keep your airways open and allow you to keep breathing throughout the night. So if you do suffer from sleep apnea, this is a potential option for you. These machines can get a little noisy though, for sure. Next up, we have night terrors, which I want to set the record straight right now. Night terrors are not the same thing as nightmares. Nightmares are something that everyone potentially gets, and it's just in your course of dreaming, you have a pretty negative, potentially very scary dream. That's a nightmare. Night terrors tend to occur mostly in children, and that is that it's more like actually kind of acting out parts almost of a nightmare, except it's still not actually a nightmare because they occur in different stages of sleep. But basically, it's like you might sit up and you might start walking around, talking incoherently. Your body is kind of, your nervous system is aroused, so you have like doubled heart rate and breathing. You might appear very terrified. However, children tend to actually not wake up during this night terror and tend to not actually remember it the next day as well. So it's kind of interesting there. But like I was saying, a difference between nightmares and night terrors are that nightmares are usually occurring during our REM sleep, our rapid eye movement sleep, but night terrors usually occur during our non-REM stage 3 sleep. So sleep terrors are an actual condition that people may have versus nightmares that everyone just gets bad dreams. Also, sleepwalking and sleep talking, two other common ones you may have heard of. So, both of these tend to occur more during childhood and tend to run in families as well. So, sleepwalking occurs during our non REM stage 3 sleep as well. It's usually pretty harmless, but that you do while you're asleep, you actually kind of get up and you start walking around. You might do specific actions like go down the stairs or those kinds of things. Again, tend to not recall these incidents of sleepwalking. And then sleep talking is just in the middle of any of your stages of sleep, you actually start literally like talking in the middle of it. And everyone kind of has this happen sometimes as well, that you're kind of like responding to someone in a dream, but you actually say it out loud. But sleep talking just is when that occurs more frequently. And that can occur in any of the sleep stages. So let's look at this one. Shortly after falling asleep, and hundreds of times during the night, Paola wakes up after a loud snore of breath because she stopped breathing. So which sleep disorder would she most likely be diagnosed with? Which of those makes you stop breathing throughout the night? That would be letter C, sleep apnea. So that's when you need that funky CPAP machine to help provide you with breath throughout the night. All right, so now we're getting to something that I think is super fun and talking about different dream theories, why we dream, what's the point of dreaming. So we see things like 8 in 10 dreams are marked by at least one negative event or emotion. So there tends to be some negative things in our dreams. Common themes include repeatedly failing in an attempt to do something, maybe being attacked, pursued, rejected, experiencing some kind of misfortune. So again, some negative things that we have come up. We also see in some studies 1 in 10 dreams among young men and 1 in 30 in young women tend to have sexual content. I do think that this image here is kind of funny. So it says, follow your dreams except for that one where you're naked at work. Probably not the best advice there. So just kind of funny there. So I do recommend that you try this, where you take a moment to write down a dream for your last night's sleep, and then think about how it relates to these different dream theories that I'm about to discuss here, and see what maybe you think the reason for that dream was. So, first up, we have Freud's theory of dreams. And I know we've kind of only dabbled a little bit into understanding some of Freud's theories, but um, he sometimes was a little out there with his thoughts and tended to relate a lot of things back to sexual urges. So, this is another instance kind of here where he's tying that into his theory of dreams. So he thought that that dreams provided a safe place to discharge certain feelings that are otherwise unacceptable to express in society. So something really important to know, those two vocab things you need to know are manifest versus latent content. So Freud says that a dream's manifest content is the actual storyline of the dream. So it's just like if you wrote down what happened in the dream, that's the manifest content. Versus the latent content, which is the more underlying um, explanation and unconscious drives that the underlying meaning of the dream. So manifest is just what's on the surface, what was the storyline of the dream. Latent is, so what does that actually mean? Why did those things happen? So again, according to Freud, he might say that seeing a gun in your dream possibly represents something like a penis. So again, going with those sexual urges and everything along Freud's theories. So Freud's belief that a dream's what content reflected the deep underlying meaning of that dream. So hopefully you can at least narrow it down to you either know it's manifest or latent. And this would be letter D, latent. The manifest is just the storyline, the latent is the underlying deeper meaning. All right, next dream theory is called the information processing theory. And that is that the purpose of our dreams is to help you kind of sift and sort through the actions and experiences of your day. So basically, that your mind kind of replays a lot of things that happen throughout the day to kind of help you process them a little more and make some kind of meaning of them and kind of help those neural connections in your brain. So that is one theory, information processing. You're just processing the information that happened throughout the day. And we can kind of see this a little bit because of the fact that sleep increases learning. So we can see this study here says that if you don't get good sleep and enough sleep after you learn new information, you won't integrate it effectively into your memories. So, super important piece of advice for you all is this explains why high school students with high grades slept about 25 minutes longer each night than their lower achieving classmates. So besides all of the health reasons that sleep is extremely important, it's also really important for you with your learning. And you'll see this a little more as we keep going through. But like if you have a test coming up, it's really, really important to get good sleep rather than to try to pull an all-nighter and cram as much information in your mind as you can, because your brain needs that time to recover and actually process the information and strengthen those pathways about what you were just learning. So we actually do see better scores with people who tend to get better night's sleep. All right, next is the physiological function theory of dreams. So again, keep in mind a theory is just different people's ideas about things. It doesn't mean that it's a proven thing, but just some ideas of why do we potentially dream. So the physiological function theory is saying that the brain activity associated with REM sleep kind of just helps to provide the brain with periodic stimulation. So rather than the brain just being fully rested the entire night, instead, this physiological function theory is saying you just need to keep the brain active. So that's one of the points of dreams, is to make sure that your brain is continuing to do some kind of work throughout the night. So that's what this is saying. And we can kind of see that with infants. They tend to spend much more of their time in REM sleep, again, saying that your brain is more active during that time. So it's important to keep the mind sharp almost. So this kind of just goes with that, showing you how over time we tend to have less sleep as we age, but then also specifically less REM sleep as we age. So infants tend to have the most REM sleep, but then that decreases as you get older. All right, another theory of dreaming is the activation synthesis theory. And this is one of the most important ones that you need to make sure that you know in terms of seeing on like an AP test, perhaps. And that is that dreams are potentially the brain's attempt to synthesize random neural activity. So basically, in the middle of your night of the night, your mind is still sending out a bunch of neural signals, and they're kind of just a whole bunch of random things happening. So this theory is saying that maybe dreams are just your brain's way of trying to understand what are all these random neural messages that I'm getting. Let me try to tie this all together somehow. And that's when it like puts it in a storyline. That's the idea of activation synthesis theory. So dreams erupt from neural activation spreading upward from the brain stem. So again, your neurons are just kind of doing a whole bunch of things. So your brain's like, whoa, what do I do with all this? Let me try to make some sense of this. And that's where your dreams come from. And potentially that's also why some crazy things might be happening in your dreams. It's all just random stuff going on. And then finally, we have the cognitive development theory of dreams. And that is that perhaps it is part of the brain maturation process of allowing your brain to develop over time. So dreams overlap with waking cognition and feature coherent speech. They simulate reality by drawing on our concepts and knowledge. So again, kind of just saying that it helps, it's a way that actually helps you throughout your development. It helps your neural pathways try to make more sense and keep your brain sharp and everything. So this is when we're going back to that try it thing from earlier of think about how maybe each of these theories could potentially apply to the dream that you thought about that you had last night or recently. Last big topic here is this idea of REM rebound. Again, REM is rapid eye movement. It is our paradoxical sleep. It's when your mind is super, super active, but your body is actually in this state of paralysis. That way you don't act out your dreams. So REM rebound is this thought that if you are getting sleep deprived, that means that you're probably not getting into that REM sleep, because if we go through our sleep cycle, we go stages 1, 2, 3, then back up to 1, and then REM, and then we go back down again. So if you're not getting a lot of sleep, that means you're probably just staying in those earlier stages and not actually getting to REM. And REM is where these really important dreams are happening for your neural connections. So that means whenever you do finally get some sleep again, you will more quickly jump back into your REM sleep. So REM rebound, meaning your brain is so sleep deprived of REM that the next time you sleep, you're going to more quickly fall into REM sleep. So your brain will try to make up for the fact that you're not getting enough REM. So clearly REM sleep is extremely important. And we can see this happen in other mammals as well. So that says clearly it's a biological need that we have for REM sleep. So sleep is super, super, super important. All right, that's it. So go ahead and look through these last couple of review slides here to just synthesize everything we talked about. But the main takeaway here is that sleep is so important. Believe me, I have been a student. Ms. Jessel's been a student. We understand how sometimes you feel like it's better to not get sleep so that you can get work done. But please do not do that. It is so, so, so important to make sure you're getting good sleep. And actually, you will be much more productive and effective at your work the next day if you are in fact getting more sleep. So it's better to get more sleep, keep your brain sharp, then focus better the next day rather than not getting sleep and just trying to stay up all night long. All right, so have a great day, everyone, and potentially great night. Have a great night's sleep, and I'll see you at the next module.